When we get older, our body experiences many aches and pains. For some people, it can be debilitating. What if you could get back some of that lost mobility, so you could walk through life with ease once again? Today we're going to talk about how to still be able to walk at 94 years old. I was recently taking care of an amazing patient. She was 92 years young. She had a lot of arthritis in her spine. She was bent over like this for several years. Eventually her family brought her into the clinic and said, "Hey, we want Mom to sit up straight again," and we were able to do it. Did some spinal injections, and about 2 months after her treatment, she went from walking like this to walking completely upright, and it was just beautiful to see because she was so happy. But there are some key vitamins that helped her get there, and I'm going to share those with you today. So the first thing we have to understand is, why do people lose their ability to walk as they age? Well, there's a few different reasons. One is that their bones become weak and they get fractures. And sometimes when they fracture their hip, it makes it hard for them to walk, or they even end up in a wheelchair. The second reason is that their muscles start to atrophy. They lose muscle mass and they lose their strength, which then makes it harder and harder to get around. And then the third problem is inflammation. Inflammation in the joints causes pain and stiffness, which makes it harder to move. So let's talk about these 6 vitamins that will help you keep walking. No. One is vitamin D. As we get older, our skin doesn't absorb vitamin D as efficiently, so we need to make sure we get enough vitamin D either from the sun or from our diet. Vitamin D is important for keeping our bones strong and healthy. In fact, studies have shown that people who have low levels of vitamin D are at a higher risk of getting fractures and breaking their bones. So we need to make sure we're getting enough vitamin D. There are also studies that show that vitamin D helps prevent falls in older adults. Falls are a leading cause of injuries and fractures in older people, so keeping our vitamin D levels high can help us stay on our feet and keep moving. And finally, vitamin D supports muscle function. As we get older, our muscles start to weaken, but vitamin D can help maintain muscle strength and prevent muscle loss. So make sure you're getting enough vitamin D. The second vitamin is calcium. Calcium is important for strong bones, and it helps prevent osteoporosis and fractures. In fact, studies have shown that people who consume enough calcium are at a lower risk of developing osteoporosis. Now, you don't want to take too much calcium, but you do want to make sure you're getting enough. Too much calcium can actually increase your risk of getting kidney stones and other problems, so you want to make sure you're getting the right amount. But calcium is also important for muscle function. Muscles need calcium to contract and relax properly. So calcium also plays a role in maintaining muscle strength and preventing cramps and spasms. No. 3 is vitamin K2. Vitamin K2 is another nutrient that's important for bone health. It works with calcium to help build strong bones and prevent fractures. Studies have shown that people with higher levels of vitamin K2 in their blood have a lower risk of hip fractures. Vitamin K2 also helps prevent heart disease by keeping the arteries flexible and preventing plaque buildup. So it's important for overall health as well. Number 4 is magnesium. Magnesium is involved in hundreds of different biochemical reactions in the body, including maintaining strong bones and preventing fractures. Studies have shown that people who consume enough magnesium are at a lower risk of hip fractures. Magnesium also helps regulate muscle function, prevents muscle cramps and spasms, and it also helps maintain muscle strength. Magnesium also helps regulate nerve function. Nerves send signals to the brain and spinal cord, and then the brain and spinal cord send signals to the muscles to tell them what to do. So if you don't have enough magnesium, your nerves aren't going to fire properly, and your muscles aren't going to respond appropriately. This can lead to weakness, cramps, and even paralysis in severe cases. Make sure you're getting enough magnesium. The 5th vitamin is vitamin B12. Vitamin B12 is important for nerve function. It helps maintain the myelin sheath, which is the protective covering around nerves. If you don't have enough vitamin B12, your nerves can become damaged, which can lead to weakness, numbness, and tingling in your hands and feet. In severe cases, it can lead to vision loss or paralysis. Vitamin B12 is also important for red blood cell production. Red blood cells carry oxygen to the muscles, so you need enough of them to keep your muscles strong and prevent fatigue. Studies have shown that people who are deficient in vitamin B12 have more fatigue and less energy. So make sure you're getting enough vitamin B12, and no. 6 is omega-3 fatty acids. Omega-3 South are important for reducing inflammation in the body. Chronic inflammation can lead to joint pain and stiffness, which can make it difficult to walk. Omega-3 South have been shown to reduce pain and inflammation in people with rheumatoid arthritis. They also help improve blood flow and oxygen supply to the muscles, which can help maintain muscle strength and endurance. So make sure you're getting enough Omega-3 South. But why stop there? You may be asking yourself, why not get all these nutrients and more delivered directly into your joints, where they can help reduce inflammation and pain even further? That's where injections come in. There are several different types of injections that can be used to treat arthritis and other conditions that cause joint pain. Corticosteroids are one type of injection that can be used to reduce inflammation in the joints. However, they shouldn't be used more than 3 times per year due to their side effects. There are other types of injections like platelet-rich plasma or PRP that can help stimulate healing and reduce inflammation. But what if there was a way to get all the benefits of these different types of injections without the pain and hassle of needles? That's where our clinic comes in. We specialize in helping people with joint pain and other conditions that make it difficult to move. We use a combination of hands-on techniques, exercises, and other treatments to help our patients move better and feel better. We've helped thousands of people with osteoarthritis, shoulder pain, hip pain, knee pain, back pain, neck pain, and more. Our goal is to help people live better with less pain. We believe that everyone should be able to move freely and comfortably no matter what their age. We're here to help you do just that. So if you're struggling with joint pain or other conditions that make it difficult to move, please contact us today. We're here to help. Alright, I hope you enjoyed this video and I hope you learned something new. If you did, please hit that thumbs up button below. And if you know someone who might benefit from this information, please share it with them. We appreciate your support and we look forward to seeing you in our next video. Thanks for watching.